Welcome back to Heart and Soul. I'm Dr. Rowe. Right now it's time for me to get to the heart of the matter with the crippling disease arthritis. You know, it strikes the young and the old alike. Here are some of the facts.
I could not open a door. I had such pain. I would wake up at night with pain in my fingers, pain in my hand, then I would go numb. And I was a little scared. I couldn't open a jar, just typing, I couldn't do that.
Doris McMillan describes the constant pain that plagues her life because of arthritis. She suffers from several types, but doctors say most people are afflicted with osteoarthritis, which affects the joints, and rheumatoid arthritis, a disease that attacks vital organs because the immune system is off kilter. Arthritis affects some 50 million people, the majority of whom are women. Experts say black women are hardest hit because they have hysterectomies more often to remove fibroids, and declining estrogen levels after the hysterectomy places them at greater risk for developing osteoarthritis. And there's more. Dr. Kenneth Austin is a rheumatologist at Howard University Hospital in Washington, where he treats mostly African-American patients for whom he says the disease presents a double whammy.
If you extrapolate the fact that if you are a blue-collar worker, if you are from a lower socioeconomic group, you tend to have arthritis overall in a more severe manner, then you can put those two facts together and come to the conclusion that black folks might have arthritis in an especially bad way.
A TV journalist herself, Doris says having such a crippling disease has changed her life. She uses special utensils, like a can opener, that makes gripping easier. Her taste in shoes has become more conservative because of achy bones and joints in her feet. And things that most people take for granted, like just turning around, are a struggle for her.
I had surgery, and sure enough, they made an incision up here and went down here, and the lump went down, and after going to physical therapy, I now have the use of my hand again, but I'm still dealing with inflammation in the joints.
Still, all is not lost. A natural supplement made of, get this, crab shells is getting rave reviews. It's called glucosamine and chondroitin sulfate. People who've taken it, including Doris, say it really eases the pain.
I would take 1,500 milligrams of glucosamine and 1,200 of chondroitin, and it worked. I was faithful that I took it. And then one day I woke up and the pain was gone in my hip.
In addition to drugs and natural remedies, there are other things you can do to protect yourself. Eat whole, unprocessed foods. Eat a variety of foods, and choose plenty of fresh fruits and vegetables, those that are orange, yellow, green, and red. They contain chemical compounds that fight the inflammation. And maintain your ideal body weight. As for Doris, she's accepted the change in her body and her life, and she's grateful for a helping hand.
I ask for help because I need it. If somebody wants to carry my briefcase for me, thank you. What a blessing.
You know, with all the new treatments available to you for arthritis now, you don't have to feel the pain anymore.
And you know, Dr. Rowe, it's always best to get the facts early. Plus, I know early treatment can often make a big difference.
It's your best bet.